And last week we had one of our fellows, talk about his thought leadership, and today we'll be having another fellow, Josephina, talk about what she's been working on, and with her guest today, to sort of shed more light on community care. So I'll be passing it on to Josephina, and she can go ahead to begin the show.
Hello, thank you so much, Dr. Comte, Sabath, and Dr. Carpenter. Really excited to be here and so excited that there's so many people joining from across the world. So welcome everyone. My name is Josephina Lin, and I'm a public health practitioner, researcher, and advocate based in Boston, Massachusetts. And as Spock mentioned, I'm one of BCPH's 2026 Thought Fellows. And today we're launching the podcast Community Care, where we explore evidence-based, community-led approaches to mental health and well-being. One of my professional roles is at Harvard Medical School's mobile health clinic, the Family Van, which started a mental wellness program called Healthy Roads that adapts Problem Management Plus, or PM Plus, which is the World Health Organization's psychological intervention. So, by the end of today's session, I hope that you'll leave with key takeaways, including first, a better understanding of this mental health support model called Problem Management Plus. Second, a deeper appreciation of the role of community health workers in supporting community wellness. And third, practical insights into how community voice can be incorporated into models of mental health support. And I'm so excited and honored that Simone is joining us for this episode. Simone is a community health worker and education program manager with Harvard Medical School. And over the years, she's worked really closely with community members across Boston, providing free health screenings, health education and coaching, and connecting residents with community resources. And she's also been deeply involved with delivering Problem Management Plus and helping adapt the program to meet the needs of the diverse communities that we serve. So, Simone, thank you so much for joining us. And also thank you to our audience. So please feel free to share questions in the chat and we'll save some time at the end to respond. So to start us off, I'd love for people to get to know you a little bit. So first, could you share about what it is that community health workers do and also what inspired you to get involved with community work?
Um, Hi everyone, thanks for having me. Simone de Oliveira. I work for the past 5 years with the Family Van, a medical Harvard School program. And I think that I have heard this before at a conference that I was. And I think that community health workers, they just are community health workers. I think there is a kind of person that sees something and says something. So community health workers are people who are like, sometimes you don't know that you might be a community health worker, but you are that person that like helps out your neighbor, that knows that like the kid of your neighbor needs a formula, and they go out and they, reach out to organizations or to other people who might be able to get that formula. So the community health worker job varies so much. And it is just like a matter of like somebody who really cares about your environment, about your community, about the people who is around you. So if you see that person that like, um, if you see that person that is always speaking up for somebody else, that's a community health worker, even if they don't call themselves a community health worker.
Yeah, it sounds like there's a real core of empathy and compassion with your role. And I know that across the world, community health workers play a variety of different roles in different organizations. For your work that you do day to day, what does it look like, and how is it different from, say, a doctor or a therapist, for example?
Well, first of all, community health workers, they are not doctors or nurses. We're not certified as doctors or nurses. I am a certified community health worker for the state of Massachusetts, but that's something very new. That's a new recognition for the work that we do. And I think that like the work that I do on a day to day is really like I don't like to say educating people because I'm not here to educate anybody. I'm not a teacher, I'm not a doctor, I'm not a nurse, but I am there to listen and to try to come up with ideas to solve the issues that they have at hand. So particularly in my case, what do we do mostly because we are a mobile health clinic that goes around Boston. We have been around for like over 35 years, 34 years, I think. And what do we do on a day to day is very like direct service on like blood pressure, blood sugar screenings, cholesterol screenings, but also like we go beyond that and we try to like check a person from head to toe. You know what I mean? So in our environment is a little more laid back. It's outside of a clinics, of hospitals, of the, you know what I mean, of those walls in their hierarchy that like comes with the clinic. So inside we are community health workers. We are just somebody like them with a little more knowledge, a little more information from the time that we have been doing this work. So we can share that knowledge, we can share that information with them and learn from them too. So I think that that's what we do kind of in a nutshell on a day-to-day um, in my community health work job.
And it sounds like that connecting with clients is a really important piece of your role. So, how does your background and your personal experiences help you connect with clients when you're serving them?
Help connecting with clients is the big chunk of my role. Like the reason why I'm a community health worker is because I can connect with clients. It's because I have the same background. It's because I can sometimes I speak English a little better than them and I can, advocate for them. So my background is like absolutely what makes me being able to be a community health worker here in this way. I am Brazilian, I speak Portuguese, I speak some Spanish. So I am Latina. So I have this connection with the Latinx community here in Boston. Um, and so I think that my background plays a significant role because it also builds trust, right? Yeah, there's no way that this program could be around Boston for 30 plus years if the community didn't trust us, didn't trust the work that we do. So consistency, trust, having the same background, somebody who speaks your language, it makes a great difference in providing care for the people in our communities. So many people might not speak English. English is not their first language. So they come in and like at the van, we can speak Portuguese, Haitian Creole, Spanish, English, and whatever we don't know, we use Google Translate. We try our ways to like figure out ways to connect with them. So I think that the background, knowing the background of the people that you're serving is very important. Yeah.
Yeah, thank you for sharing about that. And I definitely see that in the work that you do every day. You build so many relationships and trust with clients. And they really sometimes, yeah, they even come to the van looking for you specifically. They want to work with you because they trust you so much.
Mhm.
Um, Before we talk specifically about Problem Management Plus, I'd love to start with the communities that we serve. What kinds of mental health challenges or stressors do you see among community members that make a program like Problem Management Plus really important?
Well, in my past 5 years in the organization, I have seen, has been a lot of change in this past 5 years in our society and also in our communities. COVID has been a big, has have had a big impact on our communities, and we're seeing the reflex of that until today. After COVID, like I saw increasing number of people with more needs of like housing, more needs of like food, shelter, and mental health, really. Those things that we talk about, like basic things for you to survive, like food and shelter, are really heavy stressors. I don't know if that's a word, but like it's really heavy because a lot of stress in one person. But like things that they're outside of your control are the things that cause most stress for you. And that's when like you see your mental health kind of like not doing so well because you're so stressed out with like how you're gonna put food on the table, how you're gonna pay the rent for next month, So those things, and with the coming of like COVID, we saw a number of people going through those situations, and that's a something that happens then, but like until now, like what 6 years after COVID, 5 years after COVID, and we still see the reflex of that. There's, for example, change of administration. A lot of our people here in Boston, they are immigrants. They are from other places. They speak other language. You might have contact with people who are from other backgrounds, and with the new administration came with the whole issue with ICE. So we saw more people afraid of coming out. Like we saw, like at some point, we saw that the the centers, the little centers, the street where we're going, at some point we saw less people there because people are afraid of coming out. So you can only imagine the stress and the mental stress that this is causing in a community overall, especially the communities that we serve, because we see when they are not coming out, we see when they are coming in and what they're talking about, what their needs are, and definitely like the stress has been like a big issue causing like, different different mental health issues, I would say, you know. So did
It
I
sounds
answer your
like,
question?
yes, definitely. And it sounds like you have a real pulse on what's happening in the community and understanding community needs and trends that are emerging, maybe even before the data reflects that.
I would definitely. I like to see that we're a little thermometer of the community because we are out there in the community. Like we see firsthand. Like sometimes my boss comes and she's like, "Oh, this is the end of the month. People have like already received the checks. They don't have their money anymore, so they are not going around here." And then like she comes back and is like, "Oh, this is the day that they get paid." So there's like all of those things that happens on a day to day that like if you're out there on the streets and if you're out there talking to the community, you find out, you learn, you know. And like I think that the family van and like program does have a pulse, and I like to say it's like a thermometer of the community because any issue that is happening, like the community is gonna talk about. They're gonna try to like fix. They're gonna try to see like how can I work with this, And people have questions and fears. And sometimes like we being community health workers, we're the first ones who go through this, who hear their questions, who hear their fears. After COVID, for example, like the van was not going out because everything was shut down and stuff, but like we still did outreach. And we still did outreach talking about the vaccine and things like that. And we saw how much people are afraid. A lot of our communities, people in our communities were afraid because there's so much misinformation, So to have somebody there that can provide like trustworthy, reliable information, referrals, and I think is like something that is good for the community. I think that the community value that.
And I think I also appreciate you sharing about the different experiences that clients are having from housing insecurity to food insecurity to accessing medications, because it really points to the importance of expanding the continuum of care that we can provide with roles like community health workers, because clinical treatment is really important, but mental health is also shaped by things like housing or employment or social connection, or opportunities for belonging that you mentioned. Um, what are some of the main barriers you would say that prevent people from accessing traditional mental health services?
I think that one of the main barriers is really healthcare in the United States, like, right? Like, not everybody here, like, and especially again, after COVID and after the new administration, we've seen more and more people without access to healthcare. So I have seen a number of people telling me that they don't have a PCP anymore, a number of people who doesn't have health insurance. So, and this is like something new. Massachusetts has been a state that we have like more resource. we have more care, we have mass health, like, right, that should be covering everybody, but at this point it's not. So I think like one of the biggest stressors is the lack of access to those resources, and to many other resources the community need. Because again, as I said, it's not, like it's food, the shelter, is how you're gonna get your kid to school. Those things are high stressors for the community. Um, yeah, so I think that like I see the increase on that, and yeah. Did I lose the last part of your question?
Yeah,
Please remind
definitely.
me.
And I think that's such an important point, this piece about access and accessibility of services, because sometimes we can assume that if mental health services or resources exist, that people can access them, but the reality is much more complicated.
Much more complicated. Like right now, people cannot have access. Don't cannot have. There's a waiting line for people to have a primary care doctor. You might not see a specialist in 3 months, even if you have like some kind of insurance. You know what I mean? So people, a lot of times, they do wanna reach out for mental health. They do wanna reach out for something that like is gonna help them out, but like they don't know where to begin. They don't know if they're gonna have some kind of health insurance. And to be honest to you right now, if you are looking for a therapist or somebody to talk to, it is really hard to find one. And especially if you are, what I mean, looking for social programs. Like if you have a health insurance, if you're going through a hospital, it's still going to be hard for you to find. So imagine those who don't have like this safety nets of insurance, of like, where to rely on to go to for those services.
Yeah, definitely. I think that's definitely something we see every day in the communities that we serve in Boston. And I think that's a great transition to talking about Problem Management Plus
Mhm.
and how these programs can help support community mental health. So, for audience members who um, might not be familiar with Problem Management Plus, I'd love to briefly introduce it before we dive into Simoni's experience working with clients. So, Problem Management Plus, or PM Plus, is a psychological intervention developed by the World Health Organization as a way to help people experiencing stress, anxiety, depression, other common mental health concerns using evidence-based strategies that are delivered by trained non-specialists, such as community health workers. And it's something that's typically delivered over 5 90-minute sessions. And one of the things that's really exciting about PM Plus is that it recognizes that mental health support doesn't always have to come exclusively from clinical settings. And there are many models of community-led mental health interventions, including PM Plus or the Friendship Bench, which was developed in Zimbabwe by the psychiatrist Dr. Chibanda, where trained lay health workers, who are often older women in the community, provide evidence-based support through these community spaces. So I'm really excited that Simone is here to share about her experiences actually delivering PM Plus. So Simone, from your perspective, what is the philosophy behind Problem Management Plus?
I think to me, the philosophy behind the PM Plus is that, you know, again, I don't want to educate anybody. I'm not here to, who am I to educate anyone? But I'm here to support. I'm here to listen, especially, and I'm here to provide a little like light at the end of the tunnel. I believe that like when people are going through some stressors, they kind of like lose the focus. What I have seen, they kind of lose this the focus and they cannot think straight. So me, a community health worker from outside of this environment, I can give a little more clear thought to what's going on, to what the people's issue are, and talk to them. Again, I'm not a doctor, I'm not a nurse, I'm not a specialized on, you know what I mean? So, but like it's just because we I have had this experience of talking to the community for so long that I know how to listen to. So when I see a problem, somebody else's problem, it's always much easier to fix somebody else's problem than your own, right? So when I see somebody else's problem, with my clear mind, I can like focus better and try to think about like how can we together come up with solutions for this, right? Small steps, something small. You know what I mean? Like we're not talking here about fixing somebody's depression or bipolar, bipolar disease, disorder, but none of that. We're talking about like people who are struggling to get from point A to point B, who feel defeated, who feel stuck, and who could use like somebody to listen to them. You know what I mean? Because at the end of the day, we all could use somebody to talk to us, to listen to us, to, you know what I mean? At the end of the day, like you had a full day and you still have to come home and you still had to make dinner for your kids, you still have to put them to bed and like get ready for the next day, right? But like to have somebody to listen to you, I think is like one of the main uh, uh, um, goals or jewels of this program because it gives the empowers the person to like let's think straight about this problem and let's think about how can you fix this, how what can you do, what is capable for you to do, and that gives people empowerment, that gives people like a feeling of like okay, I'm doing this, and with that, it comes like the feeling of joy, right? Like once you cross something over your list or once you fix the problem that you're having, so that feeling like it kind of gets that's your gratification for have done in the work. I find it.
Like, I love what you said about we could all have use someone who could listen to us. That's so true. We could all
Oh my
use
gosh.
someone to listen to us and
Right?
these skills to help us manage stress in our everyday life.
Hmm.
I also love what you said about working together. Could you share a little bit more about how you work with clients and allow them to lead the sessions and conversations?
Oh, the how I work with clients and help them lead the is just like by asking questions and listening. Like what is the issue that you're going through? Like what is pressuring you? Like what is in your mind right now? How are you feeling right now? Like what's going on in your life? And people are really good when you genuine ask questions and listen. Like when you pay attention to what the person is saying, they're gonna open up to you. They're going to open up to you, they're going to talk to you, and they're going to say like, hey, this is my issue, this is what's going on with me, I don't know how to go from here to there. And if you ask somebody to like list all your problems, people are going to like write a list of like 10 issues, right? They might write a list of like 10 issues that they have, 10 problems that they want to solve. But like let's start small, let's start with a small one that you can achieve, and let's work on this goal, and then let's move to the next. How about that? So I think that that's like a lot of like the work and the way that I do with PM Plus is kind of like break down things, so you have a feeling of like this is manageable for me right now, you know what I mean, and then like making a repetition of that, like going through the process of like writing down your notes of like what is bothering you. And I know like those are like everything on PM Plus is basic. It's basic things that we all know, that we all have done. And you all know that, like, oh, writing down what I need to do is good. Oh, writing down the issues that I have, the problems that I have is good, so I can tackle them. We all know those things, but do we all do it? Sometimes we don't do it, right? And I'm just here to remind you, to encourage you to do those things, to go through those process, because it's not going to be every day that you're going to be with your right mind to do those things, right? Days are tough, like work is tough, like commute stuff is tough, right? So there are days that you're not going to be in the right mind to do those things, but like the days that you are, you're going to write it down, and that's going to give you courage and encourage you to keep going once you solve that little issue, and then you can tackle something else. So PM Plus, I think that like because it's spaced out in a way that like we can go from this, work on this, we have like 90 minutes to talk about this, like what is that you want to do, how you want to do, and then make a little plan, make a little project of the problem, and then like go to the next session. Like how are we doing that? How are we gonna move? What are the issues? What can we do in relation to this problem? What are the like real solutions to this problem? So let's list those solutions and let's see which one can we try first. Which one will be the easiest one to try first? Yeah, it's the same thing. It's the same thing as smart goals. It's same thing, same idea, but just like in a different form. Like again, as I said, those on the things on PM Plus is nothing that you have not seen it before. So
I love how you described this process because these skills might sound basic or foundational, things like deep breathing or these problem-solving skills, but it's so powerful when you have someone sit with you and work through it week after week. And I think it would be really interesting for the audience to hear about some of the clients whose lives you've really impacted. Maybe you help them start with a one specific area of their life and it kind of ripples outward. So I know, for example, you had a client from Brazil that you worked with. Could you share a little bit about what that was like and
absolutely,
what
it
the
was
impact was?
absolutely it was my first client, and it was so good because the client came to me because they are Brazilians. She speaks Portuguese. She's Brazilian like me, and so I have the same background. I understand what she's talking about, like not just with the language, but culturally. So I understand her culture and what she's talking about. So this client came from Brazil to stay with their kids. I have two kids who lives here, has already family, and she came with her husband to stay here in the United States. And she had her little apartment with her husband, like near the children, her like kids and stuff. But she was feeling so lonely and depressed and tired, and the problem is that like here in the US, like a lot of things are far away. Like you live in a house, if you're in a suburb, you need a car to go from one place to another. And she was this person that lived in Brazil. She was already like in her mid 60. So she had retired from her job in Brazil. But she was somebody who always worked her whole life. She worked. She was a teacher. She worked in education back in Brazil. So she worked, she took care of her kids, she did all her stuff, but she never depended on anybody to come and go anywhere. And then, like, you come to a different country where the language is different, like where the community is different, the culture is different, the environment is completely different. And then you live in a house that's far away for you to go to get things done. Do your basic things like go grocery shopping, go to, like get your massage or do your thing, whatever that is. It is far for her. So she was like, I'm feeling stuck. I'm feeling depressed. I feel like I was somebody who had so much going on in my life, and now I don't. I have my grandchildren, which I take care of them. I'm happy for that. But when I'm not doing that, like that's it. And I'm like, what did you do back in Brazil? Like, she's like, well, I had my car, I had my house. I would go visit my friends. I would go visit other people. I would help out in the church. And I'm like, what do you think would be good for you to do here that you feel good about it? That you'll be like socializing again and doing your thing and feeling independent. She's like, yeah, I think independence is the biggest thing. And I'm like, okay, what do you think that you want to do? And I left her with this question. you know so we had the first session, we talked about a number of things, and I left her with this question. And then like the following week we met up again, and I'm like, hey, what do you think? Like, what are the issues that you want to tackle? We made a little list, like what is the thing that you want to tackle? And she's like, my independence is the most important thing to me here right now, and that's what I want to tackle. And I'm like, okay, let's think about your independence. What would be good for you so you can get around? She's like, having a car. I'm like, I have a car, we have a car here, but I don't have a driver's license, and I know how to drive. And I'm like, okay, that's great, driver's license it is. So we started to look, I look online and like, what do you need to get a driver's license? I started to think about like, what is the next steps? And I would just like, all that I did was like, did a quick search online. What does she need? Go to um, the motor vehicle website, What do you need to get your driver's license? Listed all this stuff for her. And did one by one, looking for the things that she needed, like the documents, what she needed to do next. And one step at a time, she went on and she did. Like months after we had like finished our session, she had sent me a beautiful message saying like how happy she was because she has finally got her driver's license and she was able to drive around and she was so happy. She's like, this has completely changed my life. Just being able to get my independence back. And absolutely, I cannot imagine like getting your independence is something really, really important, right? So that's one of my most proud sessions and clients that I had because I saw, I saw like, you know what I mean? I did nothing. I felt like I was doing nothing, you know what I mean? But like for her, it was a big thing. For her, she was like, yeah, this is important to me, so yeah.
Thank you so much for sharing that. I know that's really inspiring for the audience to hear and really incredible impact to share. I think that it's really amazing how you shared about how you even started your relationship with her by asking her what is important to you and what do you think would be good to work on, because that's really recognizing her own strengths and her own ability to identify what's working for her and what solutions she thinks would work.
But also, like, who am I to come to somebody and say, like, hey, this is what you gotta do, and that's how it's gonna be best for you. You know what I mean? Like, and that's the problem with, I think that, like, sometimes with um, the regular medicine, like, it's just because, like, some people feel that it's really top down, that they are not listening to what the client is saying. Because nobody knows my body better than me. Like, nobody knows what I'm feeling better than myself, right? So the same thing with anybody, I think. You know what I mean? Like only you can tell what your pain is.
Hmm. Yeah, the clients are experts of their own world and lives and strengths, which is something that I think a lot of them don't experience in traditional healthcare settings.
Absolutely.
And I think that's a really, yeah, amazing description of how you're walking alongside her emotionally and through this process. And I know you also have some examples of literally walking alongside a client as you're providing them with care. Could you share about some of those examples as well?
I love to do that. Like sometimes some people come in the van and they're like, "Hey, I want to do you have HIV screenings?" And we don't have HIV screenings at the van, but like we do have resources around the van and the location, especially the neighborhoods where we are. Like the van, just for those who don't know, can I talk a little bit about the van? Is that okay? Can
Oh, of
I say a
course.
little piece? Okay. So the van, for those who don't know, the van is a mobile health clinic that has been around Boston for the past 34 years. And we are managed by community health workers. We are all community health workers at the van. The van goes out 4 days a week, from Tuesday to Friday, different locations. So Tuesdays, we are in Nubian Square in Boston. For those who are from Boston that knows Nubian Square in Boston. Wednesdays, we are in East Boston. Thursdays, we are in Codman. And Fridays, we are either Upham's Corner or Mattapan. So each of those locations, you know, each of those locations, they have unique things about them and unique communities about them. Like you go to Union Square, like majority is African American. You go to East Boston, majority are Latino speak Spanish. You go to Codman, majority are Haitian Creole. You go to Upham's Corner, majority are Cape Verdean. So like all of those people in those communities, they have different backgrounds that come together and the van is able to connect with them. So sometimes people come in and they need some service or they're like having a hard time with the clinic that is just around the corner from the event. I can just walk with them there. I can just walk with them there and like ask questions and find out like what are they not understanding and what can I translate for them? What can I help them with? So yeah, I love to walk with people where they need to go. So I do that often.
And I think that is so important for people to have someone take, even if it might be a short walk, to have someone alongside them to help them navigate this space that's unfamiliar or where they might not even speak the same language. Another thing that really stood out to me when you're describing your interactions with this client was that in Problem Management Plus, it doesn't always assume that the professionals know what's best. And as you're saying, the clients are really the experts in their own world. Um, and another unique piece of PM Plus is that clients can incorporate things like spirituality or family or culture and faith and things that are really important to them. How have you seen clients incorporate these personal aspects into the sessions?
Well, we see a lot, especially with religion, of course, like our communities are very religious, but I also seen with like nutrition, right? A lot of like PM plus is like people are complaining, they're like, oh, I'm overweight, oh, I don't exercise, oh, so we can see those with nutrition and people like taking these steps and changing and getting better and evolving after conversations and just basic conversations because again I do have the resource, I do have like the knowledge from like my previous experiences and from my time at the van to have those connections of like a dietitian or like places that I know that food's going to be cheaper for people like daily table or like other markets that I know that food will be cheaper for people, so we can always plan around things like that. And you see the difference when people come back and say like, "Hey, I lost this many pounds. I'm eating better and I'm exercising." I have this client who is completely like a model for us at the event because when we came back from after COVID, he came back and he's like, we did a cholesterol, uh, glucose, sugar, and blood pressure on him. And all his numbers were high. All his numbers were high. And he was like, no, I'm not going to do this. I'm having a discussion with him like, what do you do? Do you drink? And he's like, no, I drink a Coronita here and there. And I'm like, of course, right? A little Coronita here and there. But how many Coronitas? And he's like, well, some few every night. I'm like, well, you know what I mean? Like, what do you think about this? And like with those numbers, like, and he's like, I'm serious about this and I want to know what can I do? And I'm like, okay, you're serious about this and you want to know what you can do? Here's what you can do. You're going to have to cut the beer. You're going to have to cut the chicharron. You're going to have to, you know what I mean? But like, who am I to tell you to cut those things? I love my rice and beans. I love my chicharron. You know what I mean? But like, it's about like having a little more caution to do it better, to understand like how to eat those things. And that's our training, right? This is a training. Like we don't know how to do this. We just like start to do it and like, okay, this is how I should do. And now I'm gonna try to move forward in this direction. And it's not easy because it requires like repetition, requires staying in a line, requires to, and he did. He lost weight. He's one of our best clients. He owns a little body shop right near where we park in East Boston. He brings his kids. He brings the guys who works for him. He send the guys and he tell the guys like, you gotta go there measure your blood pressure. You gotta go there measure your blood sugar, and he tells them to go. So sometimes we have guys that waiting like in completely like mechanic uniform, and he's like, yeah, so and so send me here to check on it to take a little break. So yeah,
I think that really points to what you're describing at the beginning of our conversation about the unique power of community health workers and the way that you're able to really meet people where they are, in addition to having that deep knowledge of the community so that you can share with them resources that actually work for them.
yeah.
As you're saying, you know where their grocery stores are and what they have access to or don't have access to, and that's so powerful.
Oh, they're staple foods, right? Because who am I to come in and say like, nope, don't eat any more rice. You're not gonna eat any more rice. You gotta eat like spinach and like chicken breast and like, quinoa. Like my people are gonna be like, quinoa? No, I'm not gonna eat quinoa. I'm gonna eat rice and beans. What are you talking about? You know what I mean? So it's a matter of like, okay, you don't need to stop eating rice and beans, but how about if we add some spinach on it? What about like think about your place? You have to think about like ways of talking to people so they understand. So they like feel that like, okay, this person knows what I'm talking about. This person talks on the same level as me and they know what I'm talking about. They understand what I'm talking about. You
Mhm.
know?
Yeah, I think you're really highlighting how mental health and wellness can look different for different people, and you're really allowing the community to define what wellness means for them and to support their wellness in ways that truly work for them. Um, so I think I've, and I know the audience has really appreciated hearing about your work as a community health worker. And I'm curious if health system leaders could spend one day alongside you and community health workers in your work, what do you think they would learn?
Um, I think the one thing that they will learn is that the community is much more resilient than they think. You know, the communities are resilient, the communities have been around and they have been carrying the heavier lift of like being a city without resource. And I think like policymakers could learn that the community is resilient, but at the same time, we cannot abandon those communities. And we have to think about it like, what can we do to provide for those communities? And again, I cannot get beyond the fact that like Massachusetts is one of the better states, that we're a wealthy state, and that we have less of numbers of people in the streets or people like in really need. But still, we could do better. I believe that like with great power comes great responsibility. You know what I mean? So I believe that like if policymakers could come and they could just listen to the community has a lot to tell them, and then maybe they could like work and really improving the community's lives. Like small projects goes long ways. Like small little projects goes a long ways, and it makes a difference. It makes a difference. Like students that come to work with us, they are from the communities and they describe the programs that they've been through as they grew up. So you know that like is needed for policymakers to come and to understand the community, so that hopefully they can um, make judgments and make calls uh, on behalf of those communities that we serve. And they
Mm,
are elected to serve as well, right?
yes. And I think understanding the community as a foundation is such a nice way to wrap up our discussion. I really appreciate how you shared your experiences and your expertise and all of your wisdom from your time supporting our communities. And we've covered a lot today, from the role of community health workers to Problem Management Plus and to the importance of really building trust and relationships and integrating community voice into building any sort of mental health support. I'd love for us to share something tangible for our audience. I know you mentioned earlier, we all could use someone to listen to us. We all could have a reminder of some of these skills. Would you be able to share one of these skills from PM Plus, which is box breathing, as we kind of wrap up our session?
Sure. So I like to open my sessions with box breathing and something that is very basic. Like there's a number of ways of doing this, and like you might know from a different with a different name. But like box breathing is really good for people who have anxiety or when you're in a situation of anxiety. You know what I mean? Like they're not feeling good, or so box breathing is good for that. And the way that I do is like 4 counts. You breathe 4 counts, and then you exhale 4 counts. And then you breathe 4 counts and you exhale for 4 counts. You know what I mean? Making a box, thinking about that as like you're gonna do 2 inhales and 2 exhales and counting to 4 and then releasing, counting to 4 and then again counting to 4, like breathing. Counting to 4, exhaling, and then we do 2 more times, and then we start the sessions. And that's something that like I like to ingrain in people, so we remember that. So we remember like, oh, I'm a little stressed out right now. Let me just do a little box breathing, because it is proving that like your heart rate goes down, you feel a little more calmer. Like breathing is like first thing that you go when you are in a high stress situation, right? Your breathing becomes like, you barely can breathe. So box breathing, I think, is helpful to me on that. Yeah.
Thank you so much for sharing. I know I'm definitely going to be using that later today and throughout this week. I'd love to, I know we have some questions. I'd love to open it up to the audience. Please continue adding questions to the chat, and Simone and I are really excited to answer.
So I figured what I could do is I could read the questions aloud for you both to answer. So I think the first one here is from Kim Bullock, and she just wanted to share, like, amen, you're talking my areas in Boston. These communities have such diversity, strengths, and resourcefulness. This
Yep.
should be a part of the dialogue with our clients. Problem solving within the expanded context can lead to some really surprising solutions. And it connects with such topics as weight management. And I was just wondering if you wanted to respond to those thoughts here.
Yeah, absolutely. And again, like I think that the PM Plus, I never worked with a program like this before. And what I found out is like the good thing about it is to think about small. Think about like a small problem, because once you figure out a small problem, you know what I mean? Like for example, like losing weight. Losing weight is a big problem for some people. You know what I mean? But think about like a small problem. Like, okay, I want to lose weight, but like how do I start? Like how about instead of taking something out of your plate, adding something to a plate? Adding spinach, adding a broccoli. One thing that I like to tell clients whenever it's talking about losing weight, like think about the colors that you have in your plate. How many colors do you have in your plate? You know what I mean? And that's like a good memory a thing that I think that can help. But like again, like with PM Plus for me, is about small things, small change, small problems. Because once you solve that small problem, you gain the confidence to go into another one, right? And then you're like, okay, I could do this. Why can I not do the next thing, right? So
Yeah, I love that concept of adding. And thank you, Kim, for this comment. I really like how you're highlighting this strengths-based perspective. I think sometimes when we have conversations about mental health, it can be coming from more of a deficit perspective. But I think something like Problem Management Plus, we're really recognizing the strengths that exist in the community, and as somebody was saying, within clients themselves. Um, and that's something that we're excited to highlight in future episodes as well. Other programs throughout Boston that have models that are using peer support or community health workers or mutual aid or creative arts-based programming or social connection that are really supporting community wellness every day.
Wonderful, wonderful. I know that you spoke a great deal about community health workers in regard to things like weight loss and other mental health, issues that might arise from just the social determinants that can drive health outcomes. I was wondering if the approaches you were outlining could be applicable to those who were dealing more with infectious disease issues such as STIs or stigma around like HIV or issues like that. And I didn't know if you had worked in that arena as well.
I think it definitely can be used for that. I have had a client that, it didn't become to be HIV, but like it was a little like worrisome. So we went through the whole process of like talking to the client about that and like, you know what I mean? Like again, starting small, because who am I to talk about somebody's issue that might be so big, you know what I mean? But like what can I listen to them? What are they saying when they talking to me? You know what I mean? And from what people say, I can pick up like one or two things that like we can talk about it, that we can tackle. You know what I mean? And then again, when it is like something bigger like nutrition, losing weight, or like infectious disease, sexual transmitted disease, things like that, it is a little more complicated. You know what I mean? But like again, I think that most people wanted to be heard a lot of times. So for somebody to, even if I cannot help with anything, but I can be there to hear and say like, hey, let's come up with a plan together. Let's think about something together. Because again, like the person who is going through this stress, like they are worried about that. And like, I mean, I have my stresses too, but like when I'm at work, I get like the privilege of like doing a work that I'm engaged in that like completely take my mind out of my other issues,
Mhm.
right? So I'm focusing right there. I'm not focusing my problems. I'm focusing in like what are they going on, but I have a clear mind because those are not my problems to be able to help, to be able to discuss with them. Yeah.
So I'm just thinking about those in the audience who might be, thinking about how, like, bringing on community health workers, and to augment their teams. And I was just wondering, when you are engaged in this type of, sort of, social support in many ways, are you facilitating like warm handoffs? Are you the case manager? Are you working with case managers, or how is that happening?
With resources, we can do warm hands out. You know what I
Mhm.
mean? Like we have connections with like eye clinics. They're like we often send our clients to the eye clinic. We have connections with Harvard Neighbor Street Health Center. So we have like a warm handout there. Like a lot of the like neighborhood health centers. We are like very close to the neighborhood health centers. And then like our clients, they usually go to those neighborhood health centers.
Mhm.
So definitely there's like connections there that we do warm hands out. And like sometimes it's just like walking with them somewhere. If I don't have a connection at some place, I'll walk with them there because it's again walking distance from where we are. And I try to understand like what is there needed for them to connect with the resource that they need, that they are looking for at least, or why they lost their resource. A lot of people like have I have seen a lot of people with the situation of like they lost their healthcare, right? A lot of people this since November they have lost their healthcare, their free care, right? Because there is a new application thing you have to renew, and then like the government did this, and like a lot of people who are like past 65 years old, they have lost their Medicaid or things like that. You have to sign up back again, so people don't know. So you have to go the extra mile to ask those questions and to find out, and then like trying to like work with them, like how can I help you? What can I do?
No, that's really wonderful. And I think one of our last questions here is asking, like, how can young public health professionals contribute meaningfully to mental health equity?
Young healthcare professionals. Listen, I manage a program at the Family Van. I am the education and training manager for the Family Van. So there at the Family Van, I'm really proud to say this because there at the Family Van, we have a pathway for like students, medical students, people who wants to go to medical school, who wants to do anything in in a healthcare field. Like if you want to work in finance part of the healthcare field, that you want to like have an experience with healthcare, this is a great place for you to do that because you get hands-on experience working just like as a community health worker. But like what I want to say with that is that like my goal, my hope is that we're forming the next generation to look like the communities that they're going to be serving, to go back to serve those communities, but also like most importantly, to listen. What I have found out in this job that I am, in this work that I am, is that like the most important thing in my toolbox is my ears. I have to listen. I have to have a good ear to listen. So what I think that for the young folks that comes and spend time with me at the event, like my
Mhm.
goal, my number one goal for them is that they learn how to listen, that they come out of like medical school having a different respect for the communities, but like they
Mhm.
learn how to listen to the community, especially the women, especially the Black women in our communities. So
Mhm.
yeah.
I also
Mhm.
would add to that ending or going back to the way that Simone ended our conversation with understanding the communities. So going to wherever you are and taking time to walk around and seeing what resources exist, what community strengths exist, and Simone, for example, leads really great tours of some of these neighborhoods throughout Boston, and it's really a transformative experience for people to simply walk around and see what the neighborhood is like and take time to understand.
Don't just walk around. Get into a store. Eat something from a store. Go to the bookstore. Like Nubian Square, there's a Black-owned bookstore right there in Nubian Square. A lot of people don't know that. but it's right there in Nubian Square. And it's really cool. It's really interesting, so step out and like check out the things. Talk to the people at the stores. Talk to the people who sells food catered exactly for that community right there. They've never been before. They might not have ever been. Sorry. All right, go
No,
ahead.
it's
I'm
good.
talking too
Sometimes
much. Go
we
ahead.
call Simone's East Boston tour the unofficial food tour of East
Yeah.
Boston.
I stop everywhere and I would get like something to eat. This Boston is full of like good food, tacos, and so I love it. So I go there and like, yeah. Anybody want to join me on my tour? Like, what's going to be happening next week in East Boston? Just kidding.
Well, this is wonderful. I think that this was a really lovely conversation to like listen in on. And I know I've learned a lot and I'll be doing my box breathing, but I want to hand it off to Sabath to close us out.
Yeah, thank you so much, Josephina, and thank you so much, Simone. It was indeed a great session, and it was great having you both on board. So we look forward to the other episodes of Josephina's thought leadership, and we'll be doing this again for folks who are joining today. We'll be doing this on Friday for the last fellow that we have for this series. So we'll have Paula by 11:30 EST for our own podcast. So it would be good for all of us to join in as well. And please do engage once the podcast episodes come on. We would also promote them, and you'll get to get more insights as to what the community care um, episodes or podcasts is all about. So, from our end at BCPH, we just want to say thank you for everyone for joining. And our surveys, post-webinar surveys, will be going out. Please do help us to complete it because Josephina needs the feedback to improve the other episodes that will be coming out within the next few weeks. So thank you, everyone, and good night from here.
Yes, thank
Thank you,
you so
everyone.
much.
Thank you.
All right. Be well, everyone.
Thank you.